My name is Sheena Estifanos, a DNP student at Loyola University Chicago. I am presenting a quality improvement project on increasing universal HIV screening in primary care. The Centers for Disease Control and Prevention and the United States Preventative Service Task Force published recommendations to reduce the incidence rates of HIV. The CDC recommends universal HIV screening on patients between 13 and 64 years of age at least once in all healthcare settings. The USPSTF published similar recommendations as well. Screening patients in a primary care setting is essential in A, early HIV diagnosis and treatment initiation, B, decreasing transmission of the virus, C, reducing the progression of HIV to AIDS, D, improving the quality of life in those that are infected with HIV, and E, decreasing the increasing healthcare costs associated with AIDS complications. Scope of the problem. Approximately 1.2 million persons have been diagnosed with HIV, and an estimate of 162,000 are unknowingly living with HIV. More than one-third of the patient population infected with HIV live in a southern state, and southern state regions account for more than one-half of all HIV diagnoses in the United States. It costs approximately $237 for an HIV test for the uninsured versus $397,000 for the lifetime cost of a new HIV diagnosis, and even more for an AIDS diagnosis. Objectives of this project are to increase universal HIV screening in patients between the ages of 13 and 64 per the CDC's recommendations by implementing an EMR alert. Examine relationships between patients' demographics and their acceptance or refusal for HIV testing. Evidence-based initiative. Studies have shown that increasing universal HIV screening in the primary care setting can provide patients with an early diagnosis and treatment initiation. It can reduce the transmission of the virus and also reduce the morbidity and mortality of those affected by this virus. Using an EMR alert will help remind providers to screen patients, and providing education to providers and patients will also increase screening rates. The theoretical framework used is the Plan, Do, Study, Act model. Methods. The setting for this project is Superior Healthcare Center in Arlington, Texas. Education will be provided, and all patients that provide verbal consent between the ages of 13 and 64 will be screened for HIV. Providers will also use the EMR alert that has been implemented in the EMR. Results of this project are ongoing and data collection is underway. Evaluation. Pre and post EMR data collection will include comparison of HIV screenings before and after the EMR alert was implemented. Measure the patient's decision for acceptance or refusal of HIV screening based on their demographics. And the data analysis will include a t-test and a chi-square. Practice implementations are to increase patient HIV status awareness, provide early diagnosis so that early treatment can be provided, decrease transmission rates, decrease morbidity and mortality, decrease healthcare costs, practice improvement for APRNs and the medical assistant that works at the clinic, and compliance with the CDC and USPSTF recommendations. My references are listed there, and I want to thank you for tuning in.